5 years ago, I decided that I wanted to know more about my patients and more about my patient's anatomy. I really wanted to get into implants, but I wanted things to be predictable. And I implemented cone beam 3D imaging for my practice. And as a general dentist, it was a complete eye-opener and a complete game changer. And the product category has just continued to evolve. Images are getting better. Units are becoming a little bit more affordable. And at this meeting, there's a couple of really interesting things that have been announced. I know, Lou, that you know the whole ICAT thing, and you wanted to talk about that. So let's just let you tell us about ICAT and what they're doing.
And let me touch on what you said was affordable. Affordable to me is based on usage.
Absolutely.
You know, you're talking about $100,000 plus instruments.
Yep.
No question about it. And 100 grand, you lease it, it's still going to cost you X amount per month.
Yep.
So the last 2 months, we've been looking at how many endodontic, oral surgery cases we have referred out for scans. And we've sent out over 20 scans in the last month and a half, maybe 2 months. So I know the scans are required. And so now you have to just kind of look at what's best for your office and if your office is really ready for it. I've been on, you know, I've just been waiting and waiting. And I just saw the new iCat that's being launched at this meeting. I think it's called the iCat Flex, FLX. And what's amazing is the low dose radiation. Great pictures, 2D, 3D, everything I've seen. But it's this low dose radiation that it's, if I'm not mistaken, it's like 11 microsieverts, which means it's on the level of like a digital pan.
Yeah, absolutely.
Okay, so if I'm at the level that I take a digital pan or a cone beam, and it's considered, and it is, low dose radiation, I'm gonna want more information. Am I right or wrong?
No, you are spot on,
okay.
My friend.
So that's where I'm looking at right now. And that's being launched at this meeting, and I know you're a Gendex user, so tell me what's coming out with Gendex.
Well, Gendex has a couple of 3D products, but the one that I want to talk about right now is the DP700, and that is a stand-up unit that you can either use as a traditional 2D pan, or there is a completely separate sensor that you can apply to this machine and take 3D images as well. And what they've done with the software now is they've got a new software program out that does scatter reduction technology. And what they mean by that is that if you've ever looked at a cone beam image, you know, sometimes metallic restorations or you know, crowns, that sort of thing, they almost look like a sunburst. You get a lot of reflection of the radiation, and it kind of comes off in sort of spiky. It looks like rays of the sun. Yeah, and what they've done now is they've got a software algorithm that eliminates that, and so now you really do get a much cleaner image and a much better image, so that if you're looking at something next to you know, a restoration, or you're trying to visualize something on the tooth that has a restoration, all of a sudden now you can actually see much, much better than you ever did before. And that is something that I'm very excited about getting my hands on, because that scatter does, you know, create problems from time to time. And if you can get rid of it, I'm all for it.
I just think this is a product category that's huge for our profession, and I just think you have to see what you're doing in your practice. If it's a lot of endo, a lot of implants, what kind of size field do you need? And I just think there's so many options out there. It can be a little overwhelming.
Yeah, it can be.
But I do think if you're looking in this arena, you have to look really hard at what specifically your office is doing and what you're going to grow into, because this is definitely now in the future. It's not going to go away, for sure.
Well, and it was something that, you know, when I first got into this, I remember I went to a meeting and I took a bunch of courses on cone beam, and I walked out of those and I was like, thank God they're a radiologist, because it's way too complicated for me to figure out. And yet I kept taking courses, and I kept, you know, delving into it, and it's really not as complicated as you might think it is to really take it and read them after a while. And so it is something that we need to be aware of. It's something that people need to be looking at, because this is going to be mainstream a lot faster than I think a lot of people envision.
You look at sleep apnea.
Yep.
And you look now, they can actually look at airway. And so we can actually take these views and look at airways. And I mean, it's right then and there. And so now we're working with sleep doctors in our practice, and I'm going, this is just another pearl to have, because you know that interaction is going to come back to me in spades from the sleep clinic in itself. And again, just another use that you're not going to get out of a 2D image.
Yeah, absolutely. The ability to pick the patient's head up, hold it in your hand, take it apart, look at it in any way you want to, turn it upside down, around, inside out. You get so much more data, and you really see stuff that you just wouldn't see without it. And it's information you've got to have to do the best treatment.
And I'm going to close on one, I think, product area that really is pertinent to everybody, and it's caries detection. And I think you've got to go out there and look, because an Explorer, it's 150 years old. It's 50% what I would call sensitive or specific. It's really such an inaccurate thing. We all know that. And we've been using Diagnonet with great success for years and years. And with that as a basis, you want to look at the Canary system. I'm excited to see it. I really haven't seen it. I know we're both going to see it.
Yep.
You've used Air Techniques. I want to go see the updates in that. Is it called the Spectra system?
Yeah, Spectra.
Yeah, and I just think for all of you, you're thinking prevention. How do we prevent? If you're going to do sealants, you're going to do small and minimally invasive restorations. This is the future, and this is for everybody out there.
Absolutely. The new visual-based systems that allow you to not only just get a reading, like the Diagnonet did, you know, and still does. But now when you can actually take an image and save that image, and you can then make your judgment call. They're all data points, and you just get data. If you want to restore, you restore. But if you want to try remineralization therapy, you can monitor things and actually see, am I having an effect or not? And that's what these devices allow you to do.
Even Logicon with Kodak. It's
Absolutely.
Again, same thing. It's all about just not guessing or waiting and watching. It gives us a better...
Yeah, it's all about getting more data. More data, more information lets you make better decisions. It's as simple as that.